Okay, test. I'm going to read off of all of Lauren Haben's wonderful charts that she's made throughout the semester for review for the final. Probably be really helpful for pharm, but also will be helpful for fundamentals, foundations, whatever it is. Okay, so start off with the good stuff. Respiratory acidosis. Lab values. Less than 3.75 pH, PaCO2 over 45, and PaO2 less than 80. Bicarbonate level, if uncompensated, normal. Well, if compensated, over 26, but we don't need to know that. Respiratory alkalosis. pH higher than 745, PaCO2 less than 35, and PaO2 normal. Okay, signs and symptoms of respiratory acidosis are confusion, dizziness, lethargy, headache, ventricular dysrhythmias, warm and flushed skin, muscular twitching, convulsions, and coma. Signs and symptoms of respiratory alkalosis are dizziness, confusion, dysrhythmias, tachypnea, numbness and tingling of extremities, convulsions, and coma. Metabolic acidosis. pH less than 735. CO2 less than 35. PaO2 normal. Bicarb less than 22. Oxygen saturation normal. Signs and symptoms of metabolic acidosis are headache, lethargy, confusion, dysrhythmias, tachypnea with deep respirations, abdominal cramping, and flushed skin. That's metabolic acidosis. Metabolic alkalosis, pH greater than 745, O2 or CO2 over 45, and bicarb over 26. That's metabolic alkalosis. And the signs and symptoms of metabolic alkalosis are dizziness, dysrhythmias, numbness and tingling of fingers, toes, circummoral region around the mouth, muscle cramps, and tetany. And that is metabolic alkalosis. Okay, let's go to narcotics. Narcotic agonists. Actions. Act as a specific opioid receptor site in the CNS. Produce analgesia, sedation, euphoria. Block the pain sensation. Indications. Excuse me. Relief of severe acute or chronic pain. Analgesia during anesthesia. Cautions. Respiratory dysfunction, GI or GU surgery. Adverse reactions. Respiratory depression with apnea, cardiac arrest. Examples. Morphine, fentanyl, meperidine, and methadone and heroin. Narcotic agonists, antagonists. Actions. Act at a specific opioid receptor in the CNS, produce analgesia, sedation, and euphoria, hallucinations. Indications. Moderate to severe pain, adjunct to general anesthesia, relief of pain during labor. Cautions. Physical dependence on a narcotic, COPD, and disease of respiratory tract, and acute MI or documented coronary artery disease. Adverse reactions: respiratory depression, nausea, vomiting, constipation, biliary spasms. Examples: Buprenex, Stradol, NS, and Nubane. That's basically the one for pregnant women. Okay, narcotic antagonists. Narcotic antagonists. Actions, drugs that bind strongly to opioid receptors, but they do not activate receptor. Reverse effects of opioids. Reversal of the adverse effects of narcotics as indications. Treat narcotic and alcoholic dependence. Examples are Nelphamine or Revix, Nalazone or Narcon, and Naltrexone or Revia. And there's some narcotics. Let's go to anti-inflammatories. Okay, so NSAIDs or non-aspirin. There's 20 different types available by chemical class. A propionic would be Nalfon, ibuprofen, Motrin, Advil, naproxen or naproxen. There's acetic acid ones, or acetic acid NSAIDs, which includes Toradol, Voltaren, Indocin, and there's Phenamates, which includes meclophenamate. Action of NSAIDs: inhibit the COX-1 and COX-2 inhibitors, the COX blockers, and indications why they are used: rheumatoid arthritis, osteoarthritis, alleviate mild to moderate pain, suppress fever, relieve dysmenorrhea. And adverse effects related to blocking of enzymes, GI, blood clotting, sodium and water balance. Okay, second generation NSAID or non-aspirins. You've got Celebrex. That's just that only inhibits COX-2. Osteoarthritis, rheumatoid arthritis, acute pain, dysmenorrhea, or the indications. Adverse effects: dyspepsia, abdominal pain, renal toxicities, sulfonamide, allergy. So that's a sulfa-allergy one. Cardiovascular impact: stroke, MI, use in pregnancy, don't use in pregnancy, the Celebrex. Salicylates or ASA, that'd be aspirin or Bayer. Inhibits synthesis of prostaglandins, affects platelet aggregation, so it's antiplatelet too. Indications: antipyretic or fever blocking, analgesic or pain blocking, pain, fever, rheumatoid arthritis, osteoarthritis. Adverse effects: salicylism or mild aspirin toxicity, salicylate poisoning, GI system hepatotoxicity, and acetaminophen or Tylenol. Acts directly on thermoregulatory cells of the hypothalamus, mechanism of action unknown. Indications: antipyretic or fever, analgesic, pain. It's not an anti-inflammatory or anti-rheumatic, so not good for rheumatoid arthritis or arthritis. It does not touch inflammation. And adverse effects for aspirin. Oh wait, no, what is this? This is Tylenol. Adverse effects for Tylenol are few at normal doses, hepatotoxicity, possibly, and overdose equals hepatic necrosis. And that is your, whatever that was, anti-inflammatories. Let's go to drugs affecting upper and lower GI. Okay, you got antacids, mechanism of action: neutralize stomach acid, relieve heartburn, indigestion, help heal ulcers and GERD symptoms. drugs in that class are aluminum salts or Alternagel, calcium salts, Tums, oyster cal, or types of calcium salts. Magnesium salts would be milk mag. Sodium bicarb would be Bel-Ons. Magaldrat, which would be, or Magaldrate, would be Losapan and Riopan. PPIs, proton pump inhibitors. Mechanism of action: decreased gastric secretion by inhibiting gastric acid pump of parietal cells. They suppress the secretion of HCI into the lumen of the stomach. These all end in prazole, Prazoles, and so you have omeprazole or Prilosec, esomeprazole or Nexium, lansoprazole or Prevacid, or pantoprazole, I don't know where the stresses is, pantoprazole or Protonics. Okay, H2 blockers. Blocks histamine 2 receptor sites, leads to reduction in gastric acid secretion and reduction in overall pepsin production. These end in dine, and it's nizatidine or Axid, Ranitidine or Zantac, cimetidine or Tagamet, or famotidine, which is Pepsid. Those are the H2 blockers. GI protectants. These adhere to craters of an ulcer, protecting it from acids, pepsin, and bile salts. An example would be sulfuricate or carafate. GI protectants. Prostaglandins. Inhibit gastric acid and pepsin production. Increase bicarbonate and mucus production in the stomach. Prevents NSAID-induced gastric ulcers. So, yeah. That would be Cytotec. Misoprostol or Cytotec. Okay. And those are the drugs affecting the, well, it says upper and lower gastric. How about some nursing interventions for GI-related drugs? So, antacids, nursing interventions, check for drug interactions. Many may impair absorption of other drugs. Usually take drug first, then antacid, acid labial. Check bowel sounds to ensure GI motility. Electrolytes and renal function also. PPIs, nursing interventions, given AM before meals. Assess for black tarry stools, diarrhea, abdominal pain, persistent headache, skin assessment, and neurostatus. H2 blockers, assess level of consciousness, skin, VS. What's VS? Not sure. Cardiac effects, liver, renal function. Give with meals to prolong effect, and avoid smoking with H2 blockers. GI protectants. Give on an empty stomach 1 to 2 hours before meals. Assess skin, neurostatus, level of orientation, bowel sounds, renal function, frequent mouth cares, given as liquid. Prostaglandins. Nursing interventions, take with meals, not before. Assess for pregnancy within 2 weeks of treatment. Assess menstrual disorders, bowel sounds, and abdominal pain. Those were nursing interventions for GI meds. Now we can go to laxatives. Let's do that. And antiemetics. Okay, so constipation equals laxatives. That's what it says. Chemical stimulants. Chemical stimulants will chemically irritate lining of the GI tract, which increases motility. Examples of chemical stimulants are Cascara, Senna or Senocot, castor oil or neoloid, and
bisacodil, which is Dulcolax. Those are chemical stimulants. Bulk stimulants causes feces to increase in bulk, increase motility by increased fluid in intestinal contents. Brings the fluid into the poopy. And bulk stimulants are magnesium sulfate or Epsom salt, magnesium citrate or citrate of magnesia, lactulose or Cronulac, polycarbophil or Fibercon, psyllium or Metamucil, and polyethylene or Go Lightly. Okay, also more laxatives, lubricants. Increase the addition of fat and water into the stool to soften it. It does not stimulate peristalsis. So lubricants are glucosate or cholase, glycerin or Sanisup, and mineral oil or agorol plain, mineral oil. Okay, nausea, vomiting, and antiemetics. You got phenothiazines. These depress various areas of CNS. Phenothiazines, the only one I have in here is prochlorperazine. Prochlorperazine. And those the phenothiazines, depress various areas of the CNS. Now there's non-phenothiazines, and these decrease responsiveness of nerve cell in the CTZ to circulating chemicals that induce vomiting. And an example of that would be metoclopramide. There's anticholinergics or antihistamines, and these blocks cholinergic receptors and vomiting center. And the one I have there is meclizine. And then there's 5-HT3 receptor blockers. Blocks specific receptor sites associated with nausea and vomiting. And that one I have as ondansetron. Okay, that's it for those. Going right through these pretty quick. What's this one? Unit 6, study materials. Looks like it covers benzos and SSRIs, MAOIs and stuff. Okay, let's hit it. Benzodiazepines. Mechanism of action: acts in the limbic system and reticular formation to potentiate the effects of GABA. An inhibitory transmitter may act in spinal cord and supraspinal sites to produce muscle relaxation. Drugs in the class: Xanax, Ativan. There's a whole bunch more. Adverse effects: suicidal tendencies, decreased libido, seizures, hallucinations, muscle twitching, shuffling walk, amnesia, restlessness, jaundice, irregular heartbeat, sedation, blurred vision, headache, dry mouth, elevated liver enzymes, hypertension, hypo and hypertension, arrhythmias, palpitations, respiratory difficulty, urinary retention. You want to assess for contraindications. You want to assess baseline status, including vitals and orientation, lab tests for benzodiazepines. You have renal and liver function and CBC. Also assess bowel sounds. Nursing diagnosis related to benzos. You have disturbed thought process or disturbed sensory perception, risk for injury, disturbed sleep pattern, deficient knowledge, risk for activity intolerance. Implementation: use caution operating machinery, monitor renal liver function, and teach patient to come back routinely for testing. Taper off. Do not administer intra-arterially. Do not mix with IV drugs given parenterally, only if oral is not is an option. Give IV slowly. Reduced dose of narcotics in patient taking benzo. Antidote for benzos is flumazenil. Evaluation: monitor patient response, monitor for adverse effects, evaluate effectiveness, of teaching plan, effectiveness of comfort measures, and compliance with regimen. Okay. SSRIs. Got a mechanism of action, specifically block the reuptake of serotonin to increase the amount in the brain and increase the brain's ability to send and receive messages. Drugs in the class: fluoxetine or Prozac, citalopram or Celexa, duloxetine or Cymbalta, escitalopram, Lexapro, fluvoxamine or Lovox, paroxetine or Paxil, and sertraline or Zoloft. Adverse reactions: headache, drowsiness, rash, weight gain, insomnia, tremors, agitation, seizures, nausea, vomiting, diarrhea, dry mouth, sexual dysfunction, constipation, change in taste, painful menstruation, urgency, impotence, cough, dyspnea, upper respiratory infection, pharyngitis. Assessment: allergies, baseline status, liver and renal function tests. Nursing diagnosis: acute pain related to GI, GU, CNS effects, disturbed thought process or disturbed sensory perception, imbalanced nutrition, deficient knowledge. Implementation: caution against using herbal supplements, risk of serotonin syndrome, risk of serotonin syndrome, don't use with TCAs, decreased dose in elderly or renal hepatic impairment, monitor up to 4 weeks, suicide precautions of the severely depressed, barrier contraceptives for women. Those are, it says implementation, but I believe that's like contraindications, maybe. Evaluation: assess pain, balance diet, monitor patient response, monitor adverse reactions, evaluate teaching plan. Contraindications here: pregnancy, allergies, renal, hepatic dysfunction, diabetes, severe depression / suicidal. Okay. SNRIs. Got mechanism of action: affect neurotransmitters in the brain by blocking the absorption of serotonin and norepinephrine, as well as increasing the levels. Boost the brain's ability to send and receive messages to increase mood. Drugs in that class: Effexor and Pristiq. And there's probably some others. Adverse reactions: headache, dizziness, nervousness, insomnia, anxiety, agitation, tremor, suicidal behavior, hypertension, tachycardia, vasodilation, nausea and vomiting, constipation, dry mouth, anorexia, diarrhea, abnormal ejaculation, impotence, urinary frequency, and impaired urination. Assessment: assess for allergies, baseline, vitals, health history, including OTC meds. Nursing diagnosis: anxiety, readiness for enhanced comfort, compromised family coping. Implementation: back rubs for anxious patient, yoga for anxious patient, environmental management, creative arts and activity programs, instill hope, humor, meditation, simple relaxation techniques. Be sure to take with food and water. Evaluation: monitor INOs, daily weights, monitor vitals, especially BP. And the big bad boys, MAOIs. Mechanism of action: irreversibly inhibits MAO to break down norepinephrine, dopamine, and serotonin to relieve depression. Drugs in the class are Marplan, Nardil, and Parnate. Adverse reactions: hypertensive crisis, mania, insomnia, agitation, dizziness, excitement, nervousness, tremors, confusion, blurred vision, liver toxicity, constipation, anorexia, weight gain, dry mouth, abdominal pain, urinary retention, dysuria, incontinence, sexual dysfunction, orthostatic hypotension, and arrhythmias and palpitations. Assessment, allergies, pregnancy, neurologic status, bowel sounds, nursing diagnosis, acute pain, decreased cardiac output, disturbed thought process or disturbed sensory perception, risk for injury, deficient knowledge. Implementation, limit drug access to potentially suicidal patient, monitor the patient for 2 to 4 weeks. Monitor BP and orthostatic BP, hypertensive crisis. Monitor liver function, monitor for severe headache, and discontinue if something doesn't stop there. List of drug, food interactions. Okay, there's a ton of food interactions. Anything with tyramine in it. Reversal agent for MAOI in a hypertensive crisis is phentolamine or other adrenergic blocker. Okay, and evaluation, patient response, adverse effects. Okay, how about types of insulin? Sub-Q and IV insulin. You have your rapid, which includes Humalog, Novolog, and Apidra. It's Lispro is Humalog, Aspart is Novolog, and Glulicine is Apidra. So those are your rapids. Short are Humulin R and Novolin R. Intermediate is neutral protamine, Hagedorn, also called NPH insulin, and Detamir or Levemir. And then you have your long, which is Glargine, Lantus. So here we go. Rapids, Humalog, Novolog, Apidra. Onset's 10 minutes. Peak is 1 to 3 hours, and duration is 3 to 5 hours. You're short. The onset is the Humulin R and the Novolin R is 30 minutes onset. Peak is 2.5 hours to 5 hours, and duration is 5 to 10 hours. Intermediates, NPH or the Levemir, is 4 hours for onset, 4 to 12 hours for the peak, and duration is 16 to 24 hours. And your Lantus, long action, is 1 hour to onset. There's no peak, and last 24 hours duration. Okay, those are your insulins. And now, my favorite, the oral diabetic agents. So we'll start off with the biguanides. The class of biguanides. Example is metformin. Action: decreased glucose production by the liver, increases tissue response to insulin. Major adverse effects: GI symptoms decreased, appetite, nausea, diarrhea, lactic, GI symptoms: decreased appetite, nausea, diarrhea, lactic acid, rare. So that was your metformin, your biguanide. Thiazolindinadones. Thiazolindinadones.
the thiazolin ones. And that's Avandia, Actos. And these are similar to biguanides, and they decrease insulin. Decrease insulin resistance and thereby increase glucose uptake by muscle and decrease glucose production by the liver. Okay, and their major adverse effect is hypoglycemia, but only in the presence of excessive insulin. Okay, your sulfonylureas are chloropropamide, glipizide, and glyburide. And they promote insulin secretion by the pancreas. May also increase tissue response to insulin. And major adverse effects is hypoglycemia. Meglitinides. Your meglitinides are Prandin and Starlix. These are similar to the sulfonylureas, and they promote insulin secretion by the pancreas. Hypoglycemia is the major adverse effect. Now we got the alpha glucosidase inhibitors. That's Precoce and Glycet. And these inhibit carbohydrate digestion and absorption. GI symptoms, or for the adverse effects, you have GI symptoms, flatulence, cramps, and abdominal distension. And then you have your amylinomimetics, and that's Simlin, and it's injected only. And these cause a delay in gastric emptying and suppress glucagon secretion. Works in brain to decrease sense of hunger. And that would be hypoglycemia as well for adverse effects. And then you have your incretin mimetic, and that's Byetta, and it's also injected. And increase serum insulin by mimicking the action of incretin hormones, decreases glucagon secretion. And hypoglycemia when taken with sulfonylureas. And uses, and this one has some uses. It says in combo with hypoglycemic agents to treat diabetes. Okay. And then other oral anti-diabetic, DPP4, is sitagliptin or Januvia. And this prolongs the life of GLP-1 and GLP incretin hormones. The adverse effects are nausea, abdominal pain, diarrhea, headache, upper respiratory infection, UTI. This is Januvia. And alone, or uses alone or in combo with other therapy to reduce elevated blood glucose in type 2. And you got your anti-hypoglycemic agent, which is glucagon. And that breaks down stored glycogen to glucose. Adverse effects, nausea and vomiting. And this is to treat a hypoglycemic treat hypoglycemic reactions, most likely to these medications. Okay, anything else on that one? That's it there. So, on to upper respiratory drugs. Drugs affecting the upper respiratory system. Start off with antitussives. Antitussives act directly on the medullary cough center of the brain to depress the cough reflex. Indication is control a non-productive cough. Pharmacokinetics, rapidly absorbed, metabolized in the liver, excreted in the urine. Contraindications, patient who needs to cough to maintain airway, head injury, and impaired CNS. So those are the contraindications. And adverse effects: drying effect on mucous membranes, CNS adverse effects, and GI upset. Next class is the oral decongestants. These shrink the nasal mucous membrane by stimulating the alpha adrenergic receptors in the mucous membranes. These indication is promotion of draining of the sinuses and improving airflow. Pharmacokinetics: well absorbed, widely distributed, metabolized in liver, primarily excreted in urine. Contraindications: any condition that might be exacerbated by sympathetic activity. And adverse effects: rebound congestion and sympathetic effects. Sympathetic nervous system, that is. Okay, antihistamines. Selectively block the effects of histamine at the histamine 1 receptor sites, decreasing the allergic response. Anticholinergic and antipruritic effects. Uses are seasonal and perennial allergic rhinitis, allergic conjunctivitis, uncomplicated urticaria, and angioedema. Pharmacokinetics: well absorbed, metabolized in the liver, excreted in urine and feces. Contras: pregnancy and lactation, caution, renal or hepatic impairment, history of arrhythmias. Adverse effects: drowsiness, sedation, anticholinergic effects. Next is expectorants. These enhance the output of respiratory tract fluids by reducing the adhesiveness and surface tension of these fluids, allowing easier movement of the less viscous secretions. These are used in symptomatic relief of respiratory conditions characterized by dry, non-productive cough. They're rapidly absorbed and metabolized, and excretion has not been reported. I'm not seeing any contraindications, and even though there might be some, but I don't have them here. And GI symptoms, adverse effects: GI symptoms, headache, dizziness, mild rash. Prolonged use can mask serious underlying disorder. Okay, and then mucolytics. These work to break down mucus in order to aid the high-risk respiratory patient in coughing up thick, tenacious secretions. Thins out the secretions. It's used for patients who have difficulty coughing up secretions, patients with atelectasis, patient undergoing bronchoscopy, post-op patient with a trach. The pharmacokinetics: nebulization or direct instillation into the trachea, and caution, acute bronchospasm, peptic ulcer, esophageal varices. And adverse effects: GI upset, stomatitis, rhinorrhea, runny nose, bronchospasm, and rash. Okay, that was drugs affecting the upper respiratory system. Now, how about drugs affecting the lower respiratory system? And for these, we have bronchodilators. There's xanthines, sympathomimetics, and anticholinergics. So xanthines, therapeutic action, produces bronchodilation by relaxing smooth muscle of the bronchi, inhibits the release of slow-reacting substances of anaphylaxis, SRS, and histamine. Pharmacokinetic: narrow the therapeutic margin, rapidly absorbed in the GI tract, metabolized in liver, excreted in the urine. Drug names: you have aminophylline or trumphylline, caffeine, also theophylline or Slobid, and Theodor, and then diphenylene or Dilor. Adverse effects related to toxic reaction of drug. Sympathomimetics. This causes dilation of the bronchi, beta-2 selective adrenergic agonists, acute asthma attack, bronchospasm in acute or chronic asthma, prevention of exercise-induced asthma. Pharmacokinetics may be administered orally or by inhalation. Drug names, albuterol or Proventil, epinephrine or Susfrin, formoterol, levobuterol or Zopinex, and salmeterol or Ceravent. Adverse effects: tachycardia, angina, tremor, cardiac arrhythmias, GI upset, and bronchospasms. Anticholinergics. These bronchodilate due to an effect in blocking the vagus nerve. Maintenance treatment of bronchospasm associated with COPD. Onset 15 minutes when inhaled, peak 1 to 2 hours, duration 3 to 4 hours. Types are ipratropium or Atrovent and tiotropium or Spiriva. Adverse effects: dizziness, headache, fatigue, nervousness, dry mouth, urinary retention. Drugs affecting inflammation. These are used to suppress inflammation. Inhaled steroids. These therapeutic action is these decrease swelling, promote smooth muscle relaxation. Indication: prevention and treatment of asthma. Treat chronic steroid-dependent bronchial asthma. Pharmacokinetics: well absorbed in the respiratory tract, may take 2 to 3 weeks to reach the therapeutic levels. And adverse effects: sore throat, hoarseness, coughing, dry mouth, pharyngeal and laryngeal fungal infections. And drug names are budesonide or Pulmicort, fluticasone or Flovent, and triminaclone or Asmacort. And those are inhaled steroids, like inhalers. Leukotriene receptor antagonists. These selectively and competitively block or antagonize receptors for the production of leukotrienes. Indications: prophylaxis and chronic treatment of bronchial asthma in adults and in patients older than 12. Pharmacokinetics: rapidly absorbed in GI tract, extensively metabolized in liver, primarily excreted in feces. Adverse effects: headache, dizziness, nausea, vomiting, diarrhea, elevated liver enzymes, and generalized pain. Drug names: Singulair and Zyflo and Acolyte. And those are leukotriene receptor antagonists. And then there's mast cell stabilizers. And this works at the cellular level to inhibit the release of histamines. These are the indication is treatment of chronic bronchial asthma, exercise-induced asthma, and allergy rhinitis. And that's all I have there for the lower respiratory. Let's go to thyroid and steroids. Hypothyroidism. Thyroid replacement. Example: thyroxine, sodium, levothyroid, and synthroid. These work on T4. And then liothyronine. Oh my goodness. Liothyronine or cytomel. That works on T3. Okay. So these thyroid replacements, the action is that it replaces deficient T3 or T4, increased metabolic rate of body tissues, increased oxygen consumption, and increased heart rate and respiratory rate, which is what thyroid hormone does. It's basically the same thing. Side effects: tachycardia, hypertension, insomnia, increased bowel movements. Adverse effects: angina, heart attack, and seizures. Okay, hyperthyroidism, you get the antithyroids. And first you'd have the thiamides. The action here is prevent formation of thyroid hormone within thyroid cell, lowering serum level of thyroid hormone. Examples of this would be methimazole, or MMI, and profilothericil, or PTU. So MMI and PTU for the thiamides. Adverse effects: drowsiness, lethargy, bradycardia, and bone marrow suppression. Also, an antithyroid is iodine. This causes the thyroid cells to become oversaturated with iodine and stop producing thyroid hormone. Name: iodine. Adverse effects: hypothyroidism and goiter and stained teeth. Drugs affecting corticosteroid levels, steroid hormones from the adrenal cortex, are glucocorticoids and mineral corticoids. Names for, let's start with the glucocorticoids. In the body, you got cortisol, or hydrocortisone. Prototype drug is prednisone, or deltazone, and Prednicort. The action, or Prednicot. The action is prevent or limit inflammation by slowing or stopping all known pathways of inflammatory mediator production. Physiological effects: at low levels, cortisol and cortisone, carbohydrate, protein, fat metabolism, cardiovascular system and skeletal muscle, CNS, stress. So that's what it works on. Side effects: short-term therapy, hypertension, acne, insomnia, nervousness. Long-term therapy, side effects: adrenal gland suppression, delayed wound healing, and Cushing appearance. Adverse effects: adrenal gland atrophy and masking of infection. And then you have your mineralocorticoids. In the body is aldosterone. Prototype drug is fludrocortisone, or Florinef acetate. Action: it acts on distal renal tubule to enhance the reabsorption of sodium and to increase the urinary excretion of both potassium and hydrogen ions. Physiological effects of aldosterone: it promotes sodium and potassium hemostasis, maintains intravascular volume, harmful cardio effects in high levels, regulated by renin and the renin-angiotensin aldosterone system, or the RAS. So that's how it's regulated. I'm not seeing any side effects. Adverse effects: marked sodium retention, increased urinary K excretion. So hypokalemia and hypernatremia, maybe? Yeah, sound right? Okay. And that's it for thyroid stuff. Next, let's go to cardiac. First, I'll just read this. This is a note. This is from Jennifer Hildner. And you got the CH. This is about the heart. Congestive heart failure. Heart failure, inability for the heart to work effectively as a pump, caused by systemic hypertension in 75% of cases. Left-sided hypersensitive. Left-sided would be hypersensitive coronary artery and valvular disease involving the mitral and aortic valve, decreased tissue perfusion, poor output, pulmonary congestion, increased pressure in pulmonary valves. Okay, pulmonary congestion is increased pressure in pulmonary valves. Systolic heart failure cannot contract forcefully enough during systole to eject blood into circulation. Preload increased with decreased contractility. Dystolic heart failure is left ventricle cannot relax adequately during dystole. Inadequate relaxation prevents ventricles from filling with enough blood to ensure enough cardiac output. Right-sided heart failure is right ventricle cannot empty completely. This increases volume and pressure developed in venous system. Peripheral edema results. So, signs and symptoms of left-sided heart failure: decreased output, fatigue, weakness, cool extremities, oliguria, nocturia, weak peripheral pulses. Pulmonary congestion is a big one. And then you have hacking cough, dyspnea, breathlessness, crackles, wheezing, frothy pink sputum. Those last things were for pulmonary congestion, but that's part of left-sided heart failure. And then right-sided heart failure, you have systemic congestion, jugular vein distension, weight gain, increased blood pressure, swollen hands and feet, and dependent edema. Remember, left-sided backs up into the lungs, right-sided backs up into the body. Okay, X-rays, left-sided enlargement, valve changes, and chamber enlargement. Labs: hemoglobin, hematocrit, heart failure related to anemia, microalbuminuria, early warning detector is decreased compliance before symptoms start. ABG, hypoxia, low oxygen levels, respiratory alkalosis may occur because of hyperventilation. Respiratory acidosis may occur due to CO2 retention, and metabolic acidosis due to lactic acid retention. Interventions: optimizing SV, stroke volume, and heart volume. Non-surgical: ACE inhibitors, first-line choice, but they have the cough issue, so then you go to the Arbs. Let's start on Arb if cough is too persistent. Increase stroke volume, decrease fluid overload, monitor hyperkalemia. Diuretics, first-line choice, older adults with heart failure and fluid overload. Decrease BV. BV, I forgot what that is. Preload, systemic / pulmonary congestion. So that's what diuretics decrease all that. Digoxin increases contractility, slows heart rate. Hold if the heart rate is below 60 beats a minute. Nutrition: reduce sodium, H2O retention, eliminate or / decrease salt, ham, bacon, pickles, chips. Salt. 3 grams sodium diet for mild to moderate, 2 grams sodium diet for severe. So that's a day. I don't know. Hypertension: systolic BP at or above 140 mm/Hg, or dystolic BP at or above 90 in people with DM, diabetes mellitus. Diabetes mellitus BP below 130 over 90. Normal is 128 over 80. Pre-hypertensive is 120 to 139 over 80 to 89. Stage 1, 140 to 160 over 90 to 99. And stage 2 is 160 over 100. Essential hypertension, no known cause. 60 plus family history. High calorie intake of high sodium, low potassium, excess alcohol, obesity, and smoking. Secondary hypertension, disease states Renal disease, most common cause of secondary hypertension, sudden damage to kidneys. Assessment: history, risk factors, age, ethnicity, history, diet, drugs, alcohol, exercise patterns. Generally no symptoms, however some include headaches, dizziness, fainting, increased blood pressure. Check blood pressure in both arms, orthostatic changes, lying, sitting, standing. Retina indicated progression of hypertension. Not sure what that means. Labs: assess for renal disease, protein, RBCs, casts in urine, bun and creatinine levels. Creatinine. Men, you want it 107 to 139 milliliters a minute, or okay, whatever. 107 to 109 for creatinine for men, and women is 87 to 107. ECG, level of cardiac involvement. Left atrial ventricle hypertrophy is first sign. ECG of heart disease from hypertension. Drugs: uncomplicated hypotension via thiazide type diuretics. Men monitor for decreased libido. Diuretics: thiazide prevents sodium and H2 reabsorption, increased potassium excretion. Loop of Henle: decreased sodium reabsorption, increased sodium and potassium dumping. Potassium sparing. Inhibit reabsorption of sodium, retain potassium. Here's something on coronary artery disease. Broad includes chronic, stable angina and acute coronary syndrome. Affects arteries which provide blood, oxygen, and nutrients to the myocardium. Blocked arteries can lead to ischemia, infarction of the myocardium. Ischemia occurs when insufficient oxygen is supplied to the heart. Infarction is necrosis/cell death. Severe, prolonged ischemia causes irreversible damage to the tissues. MI is most serious, occurs when myocardial tissue is abruptly and severely deprived of oxygen. Myoglobin, earliest marker of MI, 2 hours. Troponin, that's it. Troponin, confirmed MI, occurred of heart issue, not present in healthy people. Okay. Atherosclerosis is the main cause. Stable angina, chronic chest pain, and nitroglycerin. So what you want for that? Unstable would be random, sudden chest pain. PAD, peripheral arterial disease. Change in natural flow of blood through the arteries and veins of the peripheral circulation. Result of systematic atherosclerosis, partial or total blockage or occlusion, deprives local extremities of oxygen and nutrients. Hypertension, hyperlipidemia, these are causes: hypertension, hyperlipidemia, diabetes mellitus, smoking, obesity, genetics, increased risk. Peripheral arterial disease increases risk for angina, MI, and stroke. 4 stages of peripheral artery disease. Stage 1. One sec. Okay, stage 1 of PAD is no claudication or pain. Bruit aneurysm may be present. Pedal pulses decrease or absent. Stage 2, pain, cramping, burning with exercise, claudication, and relieved at rest. Stage 3, pain at rest, numbness, burning of heel, toes, arch, pain relieved in dependent position, and
Stage 4, ulcers, blackened tissue, toes, gangrenous odor, ulcers on toes. PVD, peripheral venous disease, venous valve incompetent, venous stasis, increased pressure, impair. Okay, just say that for PVD you have lower leg edema, pain, itching, brown skin tone, leathery skin to the touch, ulcers around ankles. Symptom to relieve the symptoms would be promote circulation, elevate, no standing for a long time, ulcer care, TED hose, DVT, compression socks. So PAD, you have ulcers on toes. PVT, you have ulcers on ankles. Just remember that. Okay. Let's go to actual heart meds. You have a lot of heart meds. Let's start on the bottom and go up, why don't we? You have TPA, or alteplase, thrombolytic. It's for stroke. Converts plasminogen to plasmin by directly cleaving peptide bonds at two sites, causing fibrinolysis. Gets rid of the clot, solves the clot. It's for cerebral hemorrhage, arrhythmias, bleeding, anaphylaxis, and sepsis. Or wait, that might be... Yeah, that's side effects. Side effects would be cerebral hemorrhage, arrhythmias, bleeding, anaphylaxis, and sepsis, and you can only do it IV. Next is Plavix, antiplatelet, makes platelets slippery, inhibits binding of ADP to its platelet receptors, impeding ADP-mediated activation and subsequent platelet aggregation, irreversibly modifies the platelet ADP receptor. Side effects are skin rash, pruritus, bruising, nose bleed. Watch out for tarry stools. Notify prescriber right away. Next is aspirin, or Electrolyte. It's an antiplatelet, inhibits platelet aggregation by inhibiting platelet synthesis of thromboxane A2. You can have side effects: acute aspirin toxicity, fever, coma, cardiovascular collapse, nausea, dyspepsia, GI bleed, and dizziness. Next is cholestyramine, or Questrin, and that's a bile acid sequestrant, or anti-lipemic. This binds bile acids in the intestine, allows excretion in feces instead of reabsorption, causes cholesterol to be iodized in liver, and serum cholesterol to fall. Side effects: headache, fatigue, drowsiness, direct GI irritation, vitamin A and E deficiencies, increased bleeding time. And this is in a suspension form. Next is Simvastatin. There's statins. Zocor. It's an HMG-CoA inhibitor. This inhibits HGM-CoA, decreases serum cholesterol levels, LDLs, and triglycerides, increases HDL levels, decrease LDL 30 to 40%, decrease triglycerides 10 to 30%, increase HDLs 2 to 15%. This one, you can have side effects of flatulence, ab pain, cramps, nausea and vomiting, constipation, headache, dizziness, blurred vision, liver failure, and rhabdomyolysis, or muscle breakdown. You want to take this with your evening meal. Avoid consuming large amounts of grapefruit juice. It can take up to 4 weeks to see results. Report signs and symptoms of hepatic disorder. Okay, next we've got Gemfibrozil Zar Lopid, and that's an anti-lipemic or lipid-lowering agent. This inhibits peripheral breakdown of lipids, reduces production, abdominal pain, dyspepsia, nausea, vomiting for side effects, and you got to watch the CBC and liver function tests, and take 30 minutes before meals. Next you have spirolactone or aldactone. This is potassium-sparing diuretic for CHF, hypertension, and potassium loss. Cause the loss of sodium while retaining potassium, blocks actions of aldosterone and distal tubule. Electrolyte, the bad things are electrolyte imbalance, hyperkalemia, postural hypertension, dehydration, dizziness, headache, nausea, vomiting, abdominal pain. You got to monitor the K levels monitor for hypotension, dehydration, and INOs. Hydrochlorothiazide or hydrodiryl is a thiazide diuretic, and it's for CHF, hypertension, edema. Site of action is in the distal convoluted tubule. Inhibits the reabsorption of Na, K, Cl, keeps Cl and Na in the tubule to be excreted. Electrolyte imbalance, and then here's the side effects are electrolyte imbalance, GI disturbance, nausea, vomiting, abdominal pain, dizziness, hypertension, and vertigo. Vertigo for the thiazides. Monitor K level, take in the AM to avoid nocturia. Lasix or furosemides, or furosemide. It's a loop diuretic, the big guns, potent. CHF, HTN, and renal disease. Works in a loop of Henle to block CL pump, or was it chlorine? No. Whatever. CL pump, promote diuresis and fluid loss. Electrolyte imbalances, K, calcium loss, or potassium calcium loss, GI disturbances, dizziness, headache, tinnitus, ototoxicity, and hypotension. For side effects, also to monitor. It's rapid acting. You always have daily weights, fluid retention and loss. Administer IV very slowly. Hypokalemia risk mixed with digoxin, increased risk of digitalis toxicity. So no digoxin with the Lasix. Digoxin. It's a cardioglycoside, and it's an inotropic drug. Use it for CHF and AFib. It increases contractility of heart, decrease of heart rate, increased level of calcium inside the cell by inhibiting the sodium-potassium pump. Problems: dig toxicity, nausea, vomiting, fatigue, and these are all parts of dig toxicity: is nausea, vomiting, fatigue, confusion, colored vision, halo vision, green, yellow halos, hallucinations, flickering lights, and it also can give you hypokalemia. Okay, and watch for, it has a very low toxicity index, so monitor the apical pulse, administer without food, no food, weight, you check weights because of fluid retention, and also watch the serum K. Okay, Nadolol, the beta blocker, Corguard. Well, there's a ton of beta blockers, but these are the non-selective B1 and B2. These reduce O2 demand by blocking catecholamine. Induced increases in HR and BP, and force of myocardial contraction. Decreases renin. Watch out for bradycardia, heart failure, hypotension, increased airway resistance, hold if pulse is below 60 BPM or systolic 90, pulmonary edema, and wet cough. Okay, so that was the beta 2 non-selective. Metoprolol is your beta blocker, your selective and specific B1. That's for hypertension, angina, MI. Decreases contractility, heart rate, and myocardial O2 demand. Side effects are bradycardia, hypotension, dizziness, lethargy, depression, impotence, hypoglycemia, constipation. Men can be non-compliant because of impotence. Warn diabetics of hypoglycemia, high-fiber diet to prevent constipation. Avoid alcohol, saunas, hot tubs. Daily weights do not give if and hold if pulse is below 60 BPM or systolic is 90 or systolic 90. Below 90. Monitor for orthostatic hypotension. Okay, clonidine, central alpha agonist for hypertension, acts on CNS, preventing reuptake of norepinephrine and resulting in lower peripheral vascular resistance and BP, bradycardia, severe rebound hypertension, sedation, postural hypertension, impotence. Transdermal patch that can be worn for 7 days. Put the patch in a different place. Do not stop abruptly. Rebound hypertension could happen if you stop abruptly. Check blood pressure frequently. Learn how to take home pulse and rapid pulse. If you have a rapid pulse, consult a doctor before taking. Okay. The calcium channel blockers, or diltiazem or cardizem, used for angina and hypertension, inhibits movement of calcium ions across membranes of cardiac and arterial muscle cells, depressing the impulse and leading to slow conduction, decreased myocardial contraction and dilation of arterioles, which lowers BP and decreases myocardial oxygen consumption, and inhibits flow of calcium across cell, relaxes smooth muscle. Side effects: GI symptoms, constipation, dizziness, headache, hypotension, peripheral edema, vasodilation, related to effects on CO, cardiovascular symptoms. Increase water intake to reduce constipation. Take as ordered without sudden withdrawal, which can cause rebound hypertension. Daily weights, monitor edema, shortness of breath, and syncope. Raynaud's disease, narrowing of vessels, and periphery limited blood flow. Okay, the losartan, the sartans, or the Arbs, Cozar. Hypertension, CHF, intolerance to ACE would be your indications. Selectively binds with angiotensin II receptors in vascular smooth muscle and in adrenal cortex to block vasoconstriction and release of aldosterone, vasodilation, decreased aldosterone. Side effects is upper respiratory infection, headache, dizziness, syncope or fainting, weakness, GI, skin rash, dry skin, shortness of breath, dyspnea, weight gain. Also, monitor can be given with meals to decrease GI upset, no cough, but upper respiratory infections possible. Best with meals, combo with diuretic. Okay, ACE inhibitors, or enalapril or Vasotec. You have use that with hypertension, decreased afterload in heart failure, and MI. Blocks ACE from converting angiotensin 1 into angiotensin 2, decreases BP, decreases aldosterone, small increase in serum K along with NA, and fluid loss, prevents the vasoconstriction. Related to effects of vasodilation, side effects would be alteration in blood flow, GI irritation, renal insufficiency, that irritating cough, having to do with angiotensin 2 in the lungs, and then hyperkalemia, monitor potassium levels, caution with diuretics. Drug of choice for diabetes patients, dry cough goes away once discontinued. Do not mix with NSAIDs, decreases antihypertensive effects, increases renal failure. Slowly discontinue to avoid rebound hypertension. Okay, now we're up to nitroglycerin.
Nitroglycerin is an anti-anginal drug called nitrostat. Use it for angina. Dilates coronary arteries, opens the floodgates so more blood can get through and the heart doesn't have to work as hard. Decreases heart contractility. Side effects are headache, hypotension, bradycardia, right heart, and tachycardia. Nursing implications, angina mixed with Viagra increases hypotension, and discard after 6 months the medication, and you keep it in a dark place. And then the drug, the pentophyphline, it's the hemorrhagic agent for peripheral artery disease is pentoxifylline or Trental. And the action here is it increases flexibility of RBCs, decreases blood viscosity by inhibiting platelet aggregation and decreasing fibrinogen, thus increasing blood flow in extremities. And that's all I got for heart meds, cardiac meds. What's next? Maybe we can... Well, we've already gone over SSRIs. Let me just look at the mental health meds real quick. So you got benzos, may potentiate the effects of GABA, depress the CNS, suppress seizures, indications for anxiety, insomnia, pre-op sedation, status epilepticus, adverse effects, drowsiness, sedation, hypotension, CNS effects, contraindications, pregnancy, pulmonary, renal, hepatic impairment, history of substance abuse, and angle closure glaucoma. And I got buspirone or Buspar. It's an anxiolytic. Inhibit neuronal firing and reduce serotonin turnover. Indications for anxiety disorder, traumatic brain injury. Adverse effects, dizziness, drowsiness, tachycardia, blurred vision, dry mouth, excitement, confusion. Contraindications within 14 days of don't take within 14 days of MAOI, severe hepatic renal impairment. Okay, fluoxetine or an SSRI, Prozac, thought to be linked to drugs inhibition of CNS neuronal uptake of serotonin, used for depression, OCD, PTSD, side effects, nervousness, anxiety, insomnia, headache, drowsiness, tremors, suicidal behaviors, nausea and vomiting, dry mouth, anorexia, and asthenia, numbness maybe. 14 days after MAOI, start MAOI 5 weeks after stopping. High seizure of suicide, high risk of suicide, diabetes mellitus, seizures, mania, pregnancy. Okay, sounds great. TCAs. Elavil. Increased amount of norepinephrine and serotonin by decreasing reuptake. Depression, neuralgia, fibromyalgia, and migraine are the indications, and the side effects are stroke, seizure, coma, orthostatic hypertension, tachycardia, heart block, arrhythmias, MI, dry mouth, and hypoglycemia. 14 days after MIOI, history of seizures, glaucoma, hyperthyroids, cardiovascular disease, diabetes mellitus, impaired liver, elderly, suicide, electroconvulsive therapy. Those are all contraindicated. Okay, phenothiazine, Nardil. Oh, there's nothing on there, but that's the MAOI. You know those are bad. No tyramine. Okay, bupropion or Wellbutrin. It's an antidepressant. Weakly inhibits norepinephrine, dopamine, and serotonin reuptake. Used for seasonal affective disorder, depression, smoking cessation, abnormal adverse effects, abnormal dreams, insomnia, tremor, agitation, seizure, suicidal behavior, arrhythmias, tachycardia, rhinitis, weight loss, gain, excessive sweat. Contraindications 14 days after MAOI, history of seizures, anorexia, bulimia, MI, head trauma, abruptly stopping, alcohol, and sedatives. Lithium or Lithobid is an anti-manic. And that's, no, they're calling it an anti-manic. It's also whatever. Okay, we'll just stick with that. That was antipsychotic, but maybe not. No, anti-manic. Okay, probably alters chemical transmitters in CNS, possibly interfering with ionic mechanisms in brain cells, may compete with or replace Na ions, mania in bipolar disorder, borderline personality disorder. That's what it's for, mania and bipolar, borderline personality disorder. Side effects: fatigue, lethargy, coma, seizures, arrhythmias, bradycardia, thirst, polyuria, renal toxicity, and muscle weakness. And contras: if therapy can't be closely monitored, pregnancy. Also, unless benefits outweigh risks, don't take diuretics, thyroid, seizures, infections, CV, sodium depletion. Okay. Valproic acid or Depocate, it's an anticonvulsant, probably facilitates effects of GABA, used for seizures, mania, migraines. Side effects: asthenia, nervousness, tremor, diplopia, pancreatitis, bone marrow suppression, hemorrhage, hepatotoxicity. Stephen Johnson's, that's the one for Stephen Johnson's Depakote. Hepatic dysfunction, or contras or hepatic dysfunction, women who may become pregnant, not for kids under 10. Okay, Haldol is an antipsychotic. It blocks postsynaptic dopamine receptors in brain. It's used for psychotic disorders, psychosis, Tourette's, hiccups, prevents chemo-induced nausea and vomiting, severe extrapyramidal reaction, seizure, torsades de pointes, and leukopenia are the side effects. And Parkinson, contrared with Parkinsonism, coma, CNS, depression, history of seizures, CV disease, glaucoma, urinary retention. And then finally, olanzapine or Zyprexa. It's an antipsychotic, blocks dopamine and 5-HT2 receptors, used for schizophrenia, bipolar, treatment-resistant depression. Side effects: Parkinsonism, suicide attempt, hyperglycemia, contraindicated for heart disease, CV disease, paralytic ileus, seizures, liver impairment, at risk for aspiration, pneumonia, prostatic hyperplasia, and glaucoma. And that is it for those. Okay, that's it for all of Lauren Haben's notes, I think. If I missed one, let me know. Peace.